Hi, my name is Dr. Sheldon Peck. I'm an orthodontist in Syracuse, Utah, and have been an orthodontist here for a little over 9 years. One day I had been in my office, so we had just got back from a vacation in Europe, and I was jet lagged, and we had just moved from one office to another office, so all these things were going on, caused me quite a bit of stress. And that day that I was seeing patients, I had just a severe migraine, and I was nauseous, and each time I would, just start to work on a patient, lean my head over, I was light sensitive, and I thought I was going to throw up each time, and I thought, I can't see the rest of my patients today. And so at lunchtime, finally I got some reprieve. I went in and laid down in my office on the floor, closed my eyes, and I thought, gosh, I hope I can make it through the rest of the day, see the next 40 patients that I needed to see. So I was laying on the floor in my office, and my brother, who's a physical therapist, he came in and he looked at me on the floor and he said, "What's wrong?" And I said, I've got such a severe migraine, I don't know if I can see patients for the rest of the day. So my brother took me back, put me in one of my chairs, and he started working on my muscles to kind of downregulate this trigeminal complex of muscles around my head and neck area. After about 5 minutes of working on me, the migraine went away, my headache went away, the nausea went away, I was able to eat lunch, and I was able to work the rest of the day on my patients. And since that time, I've, with friends and family, if someone's having a migraine, I quickly can use those same techniques to deprogram their muscles. And I've had that same experience. I had one patient's mother, the patient was getting his braces off, and the mother asked if I could, or asked if I treated any kind of TMD or TMJ symptoms, and she said she had a chronic migraine. I just took her into the room, and I showed her some of these relaxation techniques that my brothers taught me, and immediately she started feeling better. But then she called me back a couple days later, and she said, as I was driving down the road, all of a sudden I felt just a tingle in all those muscles around my head, my neck, and my upper back, and my chest. She said, I felt kind of a tingle going on all over there, and I haven't had any problems or symptoms since. And she said, I'd been, contemplating going to the doctor for pain medication and for muscle injections and, all sorts of things, and, couldn't figure it out. And she said, as soon as you did that, all that kind of pain and tenderness went away. That story has been repeated multiple times in our practice. I think that the more we understand this, the more we use it, the better off we'll be as a profession, and the better off our patients will be, which is truly why we're in a profession, to be able to address the concerns of our patients.